Have you ever gone through that situation where you finish urinating, feel absolutely sure you're done, and then 2 seconds later, when you put your penis back into your underwear, you feel that last drop leak out? That annoying, unexpected feeling that seems small, but ends up bothering you all day. You ask yourself, how is that possible? I just finished. I shook. I waited. Why does this still happen? And then comes the worst part, the stain in your underwear, the embarrassment, the discomfort, the feeling of being dirty, even though you just went to the bathroom. Many people think this is normal, that it's just part of life, or that it's simply clumsiness. But what almost no man understands is that this detail can be a sign of a daily mistake that sabotages your intimate male health. And the scariest part, most men have no idea they've been doing it wrong for years. Because the truth is simple, and at the same time, shocking. The problem is not that your bladder failed. In many cases, your bladder did its job. The problem is that the final plumbing, the urethra, was not completely emptied. And when you put your penis back into your underwear with a little urine still trapped inside, any movement you make, walking, sitting, crossing your legs, standing up, and even the pressure from the fabric can squeeze that residue out at the wrong time. In other words, you think you're done, but the urine that stayed hidden leaks out later in the most inconvenient way possible. And before you think, this only happens to me, so I must be the only one, let me tell you, you're not alone. This phenomenon is so common that it has a technical name. It's called post-void dribbling, or post-micturition incontinence. Some studies suggest it can affect a significant portion of adult men, with estimates around 10% to 17%. And there's something even more important. Many men don't talk about it out of embarrassment, so the real number is probably even higher. That means many men are living with this in silence, thinking it's normal, without realizing the long-term consequences. Now here comes the first truth that changes everything. This dribbling usually doesn't happen because you're careless, unhygienic, or don't take care of yourself. It happens because of male anatomy. And once you understand that, you stop blaming yourself and start acting the right way. Unlike women, the male urethra is long. It passes through different regions and has a natural curve, almost like an S, especially near the base of the penis. There is a region called the bulbar urethra, located closer to the base, where small amounts of urine can remain trapped after you finish urinating. It's like turning off a faucet but still having some water stuck in the pipe. And in this case, the pipe has a curve. The liquid stays there. And when you move, compress it, or change position, that drop escapes. That's why simply shaking the penis often isn't enough. And here comes the second shock. The most common gesture, giving it a quick shake and putting it away, is not the most effective technique. Does it sometimes work? Yes. But for many men, especially those who experience frequent dribbling, it's not enough. Because the residue is further back in the curve, and shaking doesn't fully push it out. And this is where a simple technique can change your life. A technique based on anatomy and commonly recommended in urology practice, urethral milking. The name may sound strange, but the concept is simple. You gently push the urine trapped in the back of the urethra forward, guiding it toward the tip so it comes out before you put your penis back into your underwear. It takes seconds and makes a real difference. Pay attention, because if you do this correctly, you'll greatly reduce that last drop. After finishing urinating, instead of immediately zipping up and walking away, do this. With 2 or 3 fingers, place your hand on the perineum, the area between the anus and the scrotum. Apply gentle pressure, not force, not squeezing hard. Just a light, controlled pressure. Then slide your fingers forward toward the base of the penis, as if pushing the trapped liquid along its natural exit path. Repeat once or twice if needed. The goal is simple. Clear out what's stuck in the S curve of the urethra. Many men, when they try this properly for the first time, notice that some leftover urine actually comes out, something that wouldn't have come out with shaking alone. That's when you realize it was never random. It was always there. Now let me tell you the part most men ignore and where bigger problems begin. Dribbling itself is annoying, but the real danger lies in what comes with it: moisture and urine residue in the intimate area. We need to talk about this like adults, without embarrassment, because this is about health. Moisture is paradise for fungi and bacteria. The male genital area is naturally warmer, more enclosed, and less ventilated. When you add residual urine, you create the perfect environment for irritation, odor, and infection. This is not an exaggeration. Repeated accumulation of small amounts of urine can contribute to inflammation such as balanitis and balanoposthitis. This can lead to redness, itching, burning, discomfort, and sometimes fungal infections like candidiasis. Many men panic when this happens and try random creams, thinking they caught something. But often, it started with simple, repeated moisture. Here's the third truth many men don't like to hear. Toilet paper is not a woman's thing. It's a hygiene tool. A man who avoids it out of pride is choosing to suffer for no reason. Drying the glands with toilet paper after urinating is a golden rule. It's quick, discreet, and effective. It helps eliminate moisture that later becomes odor, irritation, and germs. If you want to eliminate the last drop and protect your intimate health, you must understand it's not enough to empty the urethra. You must also keep the area dry. If you are not circumcised, this is especially important. Make sure everything is dry before pulling the foreskin back over the glands. Storing moisture under the foreskin can cause irritation and microcracks in sensitive skin, which become entry points for infection. Sequence: empty the urethra, dry the glands, then reposition the foreskin naturally. Now, a question that seems silly but isn't. How should you position your penis in your underwear afterward? Up, down, to the side? The best option is the natural flaccid position, usually downward or slightly to the side, comfortably without forcing it. If you tuck it upward tightly against the waistband, you compress the urethra. That compression can encourage leakage and discomfort. So, milk, dry, reposition, store naturally, no squeezing. Another factor people ignore: underwear. Yes, underwear. Synthetic fabrics trap heat and reduce ventilation. Heat plus moisture. Irritation and infections. Cotton or breathable fabrics improve comfort and hygiene. This is physiology, not vanity. Important warning: not all dribbling is harmless. If, even with proper technique and hygiene, you still have significant leakage, weak stream, difficulty starting, incomplete emptying, frequent nighttime urination, pain, or urgency, see a urologist. It may be related to prostate enlargement or pelvic floor weakness. There's a difference between a tip and a diagnosis. Tips help reduce residue. Diagnosis looks for underlying problems. Most men only seek help when the problem is already serious. That's a mistake. Think about the cycle: moisture, irritation, scratching, micro-injuries, inflammation, odor, excessive washing, worse irritation, all from ignoring simple steps. So here's the practical routine. Finish urinating. Don't rush. Milk the urethra. Fingers on the perineum. Gentle forward pressure. Dry the glands with toilet paper. Reposition foreskin if needed. Store naturally. Wear breathable underwear. Basic but powerful. And be gentle. No aggressive squeezing. If you're at a urinal with no paper, prioritize drying when possible later. This is self-care, like washing your hands. Intimate hygiene is not a joke. It's prevention, comfort, confidence, and real health. Eliminating the last drop doesn't just prevent stains. It reduces moisture, odor, irritation, and infection risk. If symptoms persist, see a urologist. Listen to your body early. From today on, treat this as what it is: a small habit that protects your health. Taking care of yourself is intelligence. Start today. Apply these steps. Watch the results. You'll be surprised how a small change can bring big relief.